My preference in terms of doing a comprehensive test like NGS is to do that whenever you can. So obviously it's most reasonable to do NGS when you have a patient with stage 4 disease, and it helps you pick the frontline therapy that's best suited for a patient, meaning if they have a certain driver, I would obviously sequence them the targeted therapy up front. But I think you can make a very strong case for doing NGS even on early stage cancers, because even if a targeted therapeutic is not specifically approved in stage 1 to 3 cancers, you still have knowledge that that cancer harbors a particular gene signature and can keep that in your back pocket, so that if patients do develop recurrent disease, you can very quickly sequence them onto the best possible therapy. Now, going specifically to TRK fusion positive cancers, I think this is slightly different from some early stage lung cancers where there's no approved targeted therapeutic for stage 1 to 3, because in the regulatory data set for larotrectinib, there were certainly patients that had advanced bulky disease that was non-metastatic. And an example of this would be there were some kids that had congenital fibrosarcomas that harbored a TRK fusion, really bulky tumors of the knee. These would unfortunately have required leg amputations for therapy. But we very early on recognized the presence of a TRK fusion in these cancers, got them on the larotrectinib. They had really dramatic responses to therapy where the tumor really appreciably shrank down. And we got these kids to limb-sparing surgery. And lo and behold, when the pathologist looked at what they thought was possibly residual tumor, there was no cancer in the specimen, meaning they had what we call a complete pathologic response. And so this really highlights the utility of doing neoadjuvant therapy for certain earlier stage cancers, and that improving outcomes and hopefully improving cure. As long as there are no barriers to payer or insurance coverage for next generation sequencing testing, I personally would advocate trying to do that as early as possible.